Good afternoon, everyone, and thank you for joining us today for our Facebook Live. We are celebrating today Child Life Month with one of our very special child life specialists at Boys Town National Research Hospital. So if you know a child life specialist and you would like to give them a shout out in the comments to thank them this month, or if you're just looking to learn more about the child life profession, please tune in and go ahead and leave your comments and questions below, and we can answer them as we go through this discussion. So I'm joined today with Debbie Wagers. Debbie, how are you doing?
I am doing great. Thank you so much for having us here and letting us talk a little bit more about what it is that we do.
Yes, of course. So if we want to start, Debbie, we all know this is about child life specialists, so I already gave a little preview. But if you want to go ahead and talk a little bit more about your role at Boys Town, that would be great.
Yeah, my name's Debbie Wagers. I am a certified child life specialist and the child life supervisor here at Boys Town National Research Hospital. I have been a child life specialist for more than 30 years and have worked in two other pediatric healthcare facilities here in Omaha. I am still somewhat new to Boys Town within this past year,
Mhm.
and my role has been kind of continually evolving. I see my role now as being an advocate for our patients and families in more of an indirect way, maybe than I had in all my years in clinical practice.
Mhm.
But I think a key part of my job right now is growth.
Yeah.
So that's helping the child life staff continue to grow and evolve in their clinical skills, continuing to develop their expertise, help them become the very best child life specialists that they can be. And I also want to continue to grow our department and expand our roles beyond where they have been maybe traditionally so that we can have an even greater impact on even more children and families.
Yeah, that's great. Well, we're very lucky to have you as part of our team and appreciative that you took time out of your very busy schedule to join us here on Facebook. So, for those who have never heard of the child life profession, could you explain what it is?
Yeah. We are this group of awesome and amazing healthcare professionals whose job is to help lessen the traumatic effects of things like the healthcare environment on children and their families. We are trained professionals with expertise in helping children and their families overcome life's most challenging events. We have a strong background in child development and family systems. We promote effective coping through play, preparation, education, self expression activities. We provide emotional support for families and promote ongoing development of children. Facing kind of a broad range of challenging experiences, particularly those that are related to healthcare and hospitalization.
Mm.
And when I say related to healthcare and the hospitalization, that doesn't just mean hospitalization of the child as a patient. We also do a lot of work with children of adult patients.
Okay.
Um, we use both play and developmentally appropriate language to promote optimal development, to educate both children and their families about health conditions, to prepare children and their families for medical events and procedures. And we do that by partnering with them to determine what their needs are and then tailoring our specific interventions to help meet those needs. We plan and rehearse coping and pain management strategies with patients and families. We help children work through feelings about past experiences or maybe some of those upcoming events that they're going to have. We also partner with families to establish therapeutic relationships between the patients, brothers and sisters, and the caregivers. And we use our skill set to assist children of adult patients as well who are experiencing trauma that might be due to, tragic accidents, the new diagnosis of life-threatening illness, or may even be facing like end of life.
Mhm. Wow. So you definitely do a lot as a child life specialist. I think a lot more than people even know. So thank you for explaining all those different facets of the role. That's awesome. And yeah, if you're watching with us live and you have a question for Debbie, go ahead and leave it in the comment section and we'll get it answered. So the next one is, how does someone become a child life specialist? What qualifications and education levels are needed?
Yeah. In order to practice in the field of child life, you have to have a minimum of a bachelor's degree in either child life or a child development related sort of field. I think there are currently 15 different universities across the country that offer an undergraduate degree in child life. And I think there are 14 universities that offer a graduate level child life degree. There are other universities that offer a child life track for students.
Hmm.
Sometimes students kind of have to tailor their own program depending on where they're going to college.
Yeah.
Specifically, there are 10 core course requirements in order to be eligible to sit for the certification exam. And those include specifically a child life course taught by a child life specialist, a minimum of 2 child development courses, 1 family systems course, 1 course that's specifically on just play alone, 1 course on loss and bereavement. There's a research course, and then 3 additional courses that can include like additional child development, medical terminology sorts of, or psychology. Um, then in addition to like the educational requirements, child life specialists often complete a child life practicum, which is usually between 100 and 200 hours. And that's done at the supervision of a child life specialist, certified child life specialist. The practicum is kind of designed as an introduction to working in the healthcare environment. Or in working with children in traumatic situations. And while the practicum isn't a requirement for by the Association of Child Life Professionals, but most internship sites or many internship sites require that students have completed a practicum, and it really does kind of give them a leg up on getting an internship. And internships are extremely competitive these days. And then at the end of our educational journey, students need to complete a child life internship, which has a minimum of 600 hours in clinical experience, and you have to complete that under the supervision of a certified child life specialist. So this is where the child life student gets the opportunity to be able to work alongside a child life specialist, somewhat in an observational role initially, and then throughout the semester, they then transition to actually performing those clinical tasks. And then once all that is done, then we sit for our certification exam, and then we recertify every 5 years.
Wow. That's great to know because, yeah, I mean, now families who are watching who maybe have an upcoming experience with a child life specialist, or if they've never worked with one, rest assured they are very, very well trained and go into the career with a lot of experience. So that's awesome.
Yes, yes.
Yeah. So, can we talk a bit more about how child life specialists support patients?
Sure. We do that in a lot of different ways. Essentially, we do, whatever we can to minimize that stress and anxiety that traumatic events place upon our patients. But how we actually do that depends a lot upon the setting that we're working in. But I think one of the key things that we provide to patients is preparation. So we provide preparation at a developmentally appropriate level and in a way that they can understand. So if you think about how frightening the healthcare environment can be as an adult when you don't
Right.
understand exactly what's happening,
Right.
people are using these words you don't really quite understand. You're probably there because there's something medically wrong with you. Your doctor's trying to figure it out.
Right.
But imagine then being a child and having all of those same stressors, but also then you have this limited vocabulary and also limited life experiences to kind of pull from. So hearing something like, we're going to put you to sleep, could trigger panic in a child
Yeah.
because maybe the only experience that they've had was, at the age of 4 when their dog went to the vet and was put
Right.
to
Put
sleep.
to
And
sleep. Right.
they don't even exactly know what that means.
Right.
But,
Mhm.
what they do know is, that their dog was put to sleep and they never came back.
Right.
They know that they cried, they know their family members cried, everybody was sad, and they never ever saw their dog again. Um, and, maybe that means that their dog died, but at that very young age, they don't really understand what that means either
Yeah.
because kids
Exactly.
don't truly understand the permanence of death until they're closer to like 9 or 10.
Hmm.
So what we will do is use language that is specifically geared towards children and their developmental level. to help prepare them for things that are happening or about to happen in the healthcare environment. Um, we use things like real medical equipment to familiarize kids with what they'll see while they're here. We focus on preparing them using sensory descriptions because that's how kids learn, is through what they see, hear, feel, touch, and smell. So, rather than saying, first we're going to wrap this tourniquet around your arm and then we're going to clean your hand, we'll say something similar to, they're going to use this big blue stretchy rubber band. They're going to tie it around your arm. It's going to feel pretty tight.
Mhm.
And then the nurse is going to, clean your hand with a tiny pad that will feel kind of cold and wet. Might have kind of a strong smell, or some kids even say it's kind of stinky.
Yeah.
And then those kinds of descriptive words mean, more to a child and are, they're just more relatable for them.
Mhm.
Um, in addition to preparing kids for what things are going to happen, we also help develop coping plans that are based upon their skills and their abilities, and helping them develop skills to promote the most positive coping possible for them. We help kids and families determine which type of distraction is going to be used best for them. Um, because pain experiences, they very much depend upon the processing of pain information by the brain,
Mhm.
and like distraction can actually interrupt or even interfere with the processing of both like sensory and emotional impulses of the brain. So, we might use things like bubbles or interactive books, light up toys for like toddlers, for younger children. Again, maybe bubbles, cause and effect toys, iPad games that actually require you to be to do something interactive with them. Um, and in pre-COVID times, we could even have kids themselves blow bubbles or blow on a pinwheel. So if you think about when you get really nervous, or if kids get really nervous and really anxious, and how
Yeah.
your breathing can get kind of panicked, and you're and you get
Right.
like all nervous and all of that, well, that can actually, kind of make your veins kind of clamp down a little bit more. Whereas if we can get kids to do something something tangible that they can control, like blowing bubbles or making a pinwheel spin, that helps relax that breathing in a natural way, because it takes a really steady stream of air to be able to blow a bubble or to make that pinwheel spin at a steady pace instead of going fast and then stopping and then
Right.
going fast. um, so we really want to be able to help children develop coping strategies as well that they can build upon and use throughout their entire lifetime. And while we're doing that, we're also showing those parents or caregivers ways that they can help their children in the future.
Right.
Um, we advocate for something known as the one voice approach, the use of comfort positions, and using both pharmacological and non pharmacological ways of making procedures be less stressful.
Mhm.
Um, so if you think about like being that, that 3-year-old child who is, going to have their labs drawn, and, they're being forced to lay down while people hold you down so they can get your lab drawn. So, first of all, Gabby, how many 3-year-olds do you know that want to lay down?
Yeah.
Not many, right?
No.
Um, and, laying down is going to be the most threatening position to young kids, especially in
Right.
the healthcare environment. So they know something big is going down and they have
Mhm.
absolutely no control. So they're
I
automatically
know.
starting to fight to get up, fight and flight, they
I
panic. Um, so like teaching healthcare professionals and also parents better positioning is really instrumental in both a child's emotional health, and also in eliciting getting their cooperation. um, because I mean, if you think about it, what is it that kids want when they're having something awful done? They want to be comforted by their parent. And
right.
what does the parent want to do when their child is having something awful done? They want to support their child. So by allowing children to sit in their parents' lap when they're having things done that makes them feel more secure,
Mhm.
it gives those parents an active role, which not only makes them feel better, but it also decreases their anxiety,
Right.
which in turn can decrease the child's anxiety, and that can result in kids being like more cooperative,
Yeah.
and that in turn, makes it easier for healthcare professionals to get their job done also.
Mhm. I love how much you explained how, collaborative the whole environment is with, the parents and the providers and then the child life specialists, how they all kind of work
Hmm.
together. That's really
Yes.
comforting to know because
Yes.
especially what you said about how you guys will teach parents strategies. So if they're going to a different doctor somewhere else, they can bring that stuff with them. So it's not like starting from scratch every time they go to the doctor.
Yes,
Yeah,
because you don't always have a child life specialist in your pocket.
right. Exactly. So when we do, definitely, it's definitely special. Okay, so we kind of talked a little bit just now about how we can support the parents, but what about siblings? Because a lot of the time, you don't want them to be the forgotten one when one sibling is going through maybe a surgery or any other procedure. The sibling might have, feelings of fear or worry for their brother or sister. So, how can child life specialists help them in that situation?
Yeah, we help them understand. We provide a lot of the same things to the brothers and sisters that we will provide to the patient themselves.
Mm,
Oftentimes, especially with some of those bigger diagnoses, brothers and sisters can kind of end up being the forgotten children,
right.
so to speak, because all of the attention, and rightfully so,
Yes.
but all of that attention gets focused on the child that's the patient.
Yeah.
So brothers and sisters are often they're feeling left out, they don't understand what's happening, or they're too young to understand. They might be excessively clingy with mom and dad, not wanting to let them out of their sight because they're afraid mom and dad are going to leave and they're not going to come back because they
Right.
were gone for days and days last time. Or they might start to seek attention in other ways that are not always welcomed ways of getting
Yeah.
attention. So we work with families to kind of help bridge that gap for brothers and sisters, and to help make them feel a little bit more included. Um, we do that by we can do a lot of things, like as far as preparation with the brothers and sisters as well, providing so that they understand what's happening with their brother and sister, because knowledge is power for everybody, and so we want those brothers and sisters to have a good understanding of what's happening as well. Providing some normalcy by including them in play and in activities, using medical play both as a way of learning about the healthcare environment, and also as an outlet for what they might be thinking and feeling inside. Children often don't have the ability to be able to tell us what they're thinking and feeling inside. So especially young children don't often have the words to be able to tell you what they're afraid of.
Hmm.
And older children, they may have the words to tell you, but they might be afraid to tell you for whatever reason.
Yeah.
But what we know is that if you give children the right tools, they will show you through their play. So a lot of what we do with helping the brothers and sisters understand, and then also helping the parents understand the importance of we just call keeping it real,
Yep.
and that discipline and normalcy and boundaries and all of that are still very, very, very important. And it helps regardless of what kids say, but it helps them feel safe and secure when they have boundaries and that they have limits. And so we just try to, we don't treat the child, we treat the family. So it's
Hmm.
really important.
Yeah, and we talk about all these things too on our Boys Town Parenting Facebook page. We do monthly parenting live streams where we talk about an array of different situations that parents are facing. And a lot of the advice that those experts give out is very much the same of
Yes.
maintaining, boundaries and normalcy and, not letting things just slide under the rug when something else in life is going on. And I love what you
Yes.
said about how, trying to keep it as normal with we still parent this way. We still have timeouts. We still, do all
Yeah.
this when a healthcare thing is going on, even though it's
Yes.
yeah. So this is an important question that was submitted. Do patients at Boys Town Hospital or Boys Town Pediatrics automatically get the help of a child life specialist during their stay, or do they need to request one?
My answer is yes, and sometimes. So,
Yeah.
if you have a child who is going to be here for an inpatient stay, so whether that's in our general pediatrics or our pediatric intensive care unit, hopefully not, but if you do, and it's a Monday through Friday, we currently have Monday through Friday coverage, you will automatically receive child life services. We also have child life specialists who cover in our surgery center. We try to see all of our patients on the hospital side, the inpatient and the surgery side. But sometimes the sheer numbers prevent us from doing that always in the surgery side. Um, So if you are here receiving services and either in our inpatient units or in surgery and you have not seen a child life specialist, you can certainly ask for one to see you because it is our intention to get there. We sometimes kind of have to triage. Um, if your child is scheduled to have like an outpatient diagnostic test, like an EEG, they're having immunizations, having labs drawn, an MRI, something like that, you can ask for child life to be consulted and we will do our very best to be there. And that would be at both the East and the West campuses. I also wanted to let everybody know that our staff currently have created 3 different teaching videos. There's more to come, but
Oh, nice.
they've created 3 different teaching videos that are available on the hospital website at www.boystownhospital.org. So if you go to the website and type in child life into the little search window, it'll take you to the child life page. And there you'll find a video for if you have a child that's coming here for surgery, walks them through the whole thing. They'll get to see a lot of the things that they'll see when they come. Also, we have one for having an MRI done or also having an EEG. And the staff just did a phenomenal job. And so these are like great tools that parents can use to help prepare kids for some of our more common medical experiences. But I do have one more thing I want to tell you. We
Oh,
are like also really, really excited to be adding 2 new full-time child life specialists to our hospital services at Boys Town.
nice. Yay.
Yay, yay. So these new positions will extend our coverage during the week until the early evening hours, and then we'll also provide coverage to some of our outpatient pediatric clinics.
Great.
Um, so we are extremely excited to be able to offer this service because we're going to be the only hospital in the region that offers child life coverage in the pediatric clinics. So I just truly think that this kind of sets us apart and demonstrates Boys Town's genuine commitment to children and families. I think that Boys Town sees Child Life's vision on the importance of pain control, comfort positioning, developing positive coping techniques, and how reaching families while their children are young, even as early as infancy, how that can impact them and their healthcare experiences throughout their entire lifespan.
Definitely. Well, that is super exciting. I'm really glad you mentioned that. To have that
Yeah.
support in the pediatric clinics, like you said, is super rare in our region, unfortunately. But,
Yes.
having that addition will be awesome. And maybe the other clinics, in the region can take a cue and do the same. So everyone can have
Yes.
child life services. Right. That's
Yes.
awesome.
Yes.
Great. So, like I said, if you're watching live, there is still time to comment questions for Debbie or go ahead and just give this video a like and please share it so everyone else on your Facebook friend list can watch this. And I also will make sure to link those videos that Debbie mentioned, the surgery one, the EEG, and the MRI. I have all those links, so I'll post them in the comments so you can watch those too.
Awesome.
Okay, so the next question is how do child life specialists work with nurses, doctors, and other team members of a patient's care team?
Okay. So we're just one part of the healthcare team, and we work collaboratively with all of the other professionals to help our patients meet their healthcare goals. So, it might be the doctor's job to perform a surgery in a patient, and then the nursing staff's job to provide all the medical care. But, then it might be child life's job, to help get the patient with that big incision, get them motivated to get up out of bed and get moving, or maybe using parts of their body in play that they might not otherwise because, they're afraid it's going to hurt.
Right.
But we find that if you can get a child fully immersed in something fun and something that excites them, then you can often have them doing things that they might have refused to do earlier. We also work with the healthcare team to reduce the amount and type of sedation needed for different medical procedures. I think sometimes adults assume that children will need to be sedated for things that they can often do without sedation, but it usually takes preparing them adequately ahead of time, which can sometimes take an additional time, but in the end it's very definitely worth it.
Mhm.
um, I know that hospitals often find that they can save thousands of dollars by enlisting the services of Child Life to prepare children for tests and treatments. An example of this, I know of another hospital who had 6 patients that were ages, 4 to 5,
Mhm.
who completed their radiation treatments without the use of anesthesia, where prior to Child Life involvement, all patients under the age of 5 were automatically already sedated for their anesthesia treatment. So, like these 6 patients completed a total of like 91 radiation therapy sessions
Wow.
without anesthesia. And so by doing this without anesthesia, the hospital, I mean, they were able to save, close to $100,000 on just those
Right.
6 patients. And just so you know, that is far more than what a child life specialist gets paid. So
Yes.
it
The
was a good
investment is
cost
worth
savings
it.
for the hospital. Yeah,
Right.
very.
Wow.
We also work with, oh wait, I wanted to say something about, I think that we are very much the drivers of ensuring the emotional safety of our patients. We talk a lot about that in child life. For example, the National Traumatic Stress Net. Oh, let me say that again.
You're
I
fine.
always get tongue tied. The National Child Traumatic Stress Network reports that like 80% of children or their family members report some sort of traumatic stress following the treatment for either a life-threatening illness, an injury, or a medical procedure in a hospital environment. So this wasn't because of the illness or the injury, but it was
Yeah.
because of the care that they were provided. So what we want to try to ensure is that emotional safety component of healthcare. We want to make sure that the emotional safety component is equal to the physical safety component of the healthcare. And we want to make sure that we are not emotionally harming our patients in our quest to heal them physically. And I think that Child Life are very much drivers of that.
Yeah. I mean, for parents to hear that, just how much you guys advocate for their children is very comforting. So I'm glad you mentioned that.
Thanks.
Okay, so we got just a couple more questions here. What, in your opinion, Debbie, makes being a child life specialist unique? Since you have over 30 years of experience, I'm
Yeah.
sure you have a great perspective.
Since you're really old. Um, so no, I think that we just don't think like other healthcare professionals, and I think
Yeah,
that we even sometimes forget that,
right.
because something that will be something completely common sense to us will not make sense sometimes to those people that are working around us.
Yeah.
Um, I think there's sometimes the what I call the buck up, buttercup mentality, and I think that sometimes healthcare professionals can kind of get caught up in the piece of care that they provide, the tasks of that they have of caring for the patient, and that they don't always see it through the eyes of a child and their family.
Mhm.
Um, I think that we sometimes forget that even though we are providing, the care we're providing for a child is a very small blip in time, but that blip can have lifelong and sometimes devastating effects.
Right.
Um, Even from something as simple as a lab draw or immunizations or anesthesia induction or having an MRI. And that just because, a child gets through it doesn't mean that they haven't gotten through it without being traumatized. And not only can this trauma affect them in the short term, but we also know that this can have, ongoing lifelong physical and emotional issues in the long term. Um, we know that children who have traumatic experiences with healthcare as a child are more likely to become medically avoidant adults.
Okay.
So we also know that things like needle phobia often begin in childhood and can last into adulthood.
Right.
Um, it's estimated that something like 20 to 25% of all adults have a needle phobia. So, if we are not taking care of these patients when they are young and helping them develop more positive coping strategies when they're young, those fears are just going to continue to grow and become more ingrained in them, which again can lead to like medical avoidance in the future. And, medical avoidance is, I mean, it's a real thing
Yeah.
and it can sometimes lead to delayed diagnosis of conditions or not being diagnosed at all, or sometimes even being diagnosed but not diagnosed until it's too late. So we want to be able to impact kids as early as we can.
Yes, definitely. So, what is one thing that you wish people knew about being a child life specialist?
Um, I think the one thing we want everyone to know is what might on the surface just look like we are just playing is actually play with a purpose.
Yeah.
Um, Although sometimes we do just play for the sake of playing because there's nothing more therapeutic and of course it's fun, right? Um, but I also want people to know that we have a very specific yet a very diverse skill set. So we are trained to deal with children affected by trauma. Most commonly, you're going to find us in hospitals or healthcare settings, but we work with children in a variety of settings. You can find child life specialists working in hospice, both pediatric and adult hospice. In pediatric hospice, not only are we creating a legacy for children through activities and legacy pieces like hand molds and footprints and fingerprints and creating works of art and all of those sorts of things, but we're also helping patients and families talk about death. And so, for example, if you are a parent and you're facing the reality of losing a child, the last thing you want to do is talk about what happens, what happens when your
Right.
child is gone.
Yeah.
um, what might that dying or grieving process even look like? What does your child want? How do they want to be treated? I mean, how do you even begin to think about
Yeah.
all of that when you are trying to process it yourself? So, Child Life can help with that. We can help bridge that gap. We can provide a safe and open space for kids to ask questions, talk about things that they are naturally wondering about, like, what's it like in heaven? What happens to your body?
Hmm.
Um, or even just talking about maybe some of those guilty feelings that they have about leaving their parents and their family and their friends behind. That's a lot for anyone to deal with. We use our skill set to help kids process what's happening and allow them an outlet for an expression. Um, we provide those same types of services for children of adults who may be dying or who have been in an accident. And again, when you're an adult dealing with your own grief, knowing how to help the children and teens can just be beyond your comprehension or abilities at that time. And so the kids are often just kind of left there, watching and wondering and trying to figure
Hmm.
it out for themselves. They often want to ask questions, but they're afraid to ask questions because undoubtedly, it's going to make somebody cry.
Yeah.
So I just want people to know, we can help.
Right.
Um, One other thing, you will also find us doing a lot of work in disaster relief.
Mm.
Although for now it's mostly volunteer work, but Child Life Specialists have formed connections with other disaster relief services, and we've actually created our own disaster response team known as Child Life Disaster Relief.
Wow.
We deploy to disasters across the country, providing support to children in the immediate aftermath of disasters, and it's usually within that first 24 to 48 hours, which are absolutely critical. We're training other volunteers and professionals who are on the front lines in disasters, helping them know what children need, what to say, how to approach kids, how to help them. So we're not only experts in child development, but in kids impacted by stress and trauma, and that can come in a lot of different ways and places. And I don't want to make everything sound like that. Kind of sounded like all doom and gloom. It's just a very important part of what it is that
Yeah.
we do. But I also want you guys to know that we are experts in play. We
Right.
do love to play. Um, I always say that, like a carpenter, their tools are using things like hammers and nails. And for child life, I just consider our tool is play. And that's what we
Yeah.
use in everything that we do and the way we connect with kids and families. So,
Yeah, I love that you talked, on the full spectrum of everything that, because I saw a Facebook post even the other day. It was in recognition of Child Life Month, and it was something like, well, you think I just, go to work
yeah.
and play with kids all day, but
Yeah.
in all actuality, I mean, this is why we're doing this live, is because it's so much more than that, and it's so much that on the adult side of things is often, like you said, too much to bear, or maybe an afterthought when the adults are trying to figure stuff out and can't always explain things to the children. So in my
Yes.
opinion, I think the child life specialists are like angels on earth, and we're really lucky to have
Oh,
them at Boys Town. So,
thank you.
with that, because you guys care for others so well, during Child Life Month, how can we, the public, support child life specialists and recognize them during this awareness month?
My initial answer is chocolate and
Yeah.
coffee.
Yep.
But you're probably looking for something a little less. Yeah. Um, I think one thing is allow us to help you. Um, Obviously, everybody in the healthcare profession, we're all caregivers and we all want to help people. But in child life, allow us to help you. Whether you're a patient, a parent, or a caregiver, another healthcare professional. Um, on the patient side, our job is to make the lives of children and their families better, right? And for the staffs that work alongside us, Well, our job is first and foremost to advocate for that emotional safety for our patients, because we know those experiences are going to impact them for the rest of their lives. But, letting us do our jobs will, help make your jobs easier also. We aren't going in there, to try to make it so that a kid won't cry. In fact, I usually worry more about those kids that don't cry. But
Right.
I think that our measure of success is if we can change those statistics from the National Child Traumatic Safety Network, where there will no longer be 80% of children or their family members reporting traumatic stress, following medical encounters. I would also say that um, the the hospitals here in Omaha, and I know we have people watching from all out, but all children's hospitals or have large pediatric populations, you're going to find child life there. So if you are at a facility that does not have child life, do not be afraid to reach out to child life in other places.
Hmm.
We are always wanting to help and to be able to help share our knowledge, because our mission is to help make children's lives better.
Yes. Well, thank you, Debbie. This was such a great video, and to learn so much more about this behind the scenes kind of what it's like to be a child life specialist is very meaningful. And we're happy that, yeah, we could take time and kind of honor this profession during Child Life Month.
Bet. Thank you very much.
Yes. Thank you to everyone watching, and please give a shout out. Thank a child life specialist in the comments of this video if you know one. And we hope you have a great rest of your day. Bye bye.